Hello, I am Dr. Prameela and I am with Mr. Dipak Prasad who is working as a special educator in Birla School, Pilani. Mr. Dipak specializes in special education. He is a proud recipient of award Outstanding International Volunteer Award 2013 by Ho Chi Minh Communist Union of Vietnam and UNDP Vietnam. He has a robust experience in the field of special education. His career spans over 18 years. Mr. Dipak has been associated with the education of special needs children worldwide, including Asia Pacific, Europe, and Middle East. Today, we are here to share brief findings of his work during his association with early identification and prevention of learning difficulties. We will cover this topic in two different parts. In first part, we will cover the introduction and examples of early identification and prevention of learning difficulties, and in the next part, we will cover the indicators of early identification.
Thank you, ma'am.
So, Mr. Dipak, according to you, what is early identification?
Early identification, this is a process of identifying children's developmental delays as early as possible.
Yes.
Or any critical identification of any critical issues, which the children are facing.
Yes.
It is very important process to prevent further complications in children's life.
Yes. So that if some difficulty is happening or we are seeing any difficulty, that can be seen as early as possible.
Yeah.
Okay.
So, because as parents, we really want to see our children happy and healthy, aren't we?
Yes. As parents, we would like to see our children happy and healthy.
And if we really want to see them healthy and happy, early identification and prevention play major role in it.
Yes. Okay, Mr. Dipak, now I would like to know why is it important to identify these symptoms early?
Yeah, there is a famous proverb that early identification and prevention is better than cure. So, rather than running after doctors, we have to identify those issues as soon as possible.
Yes.
Identification of critical issues of children. If we do this as soon as possible, we can plan the preventive measures in hand.
Yes.
And then after planning, we can extend our supports through interventional strategies. And as soon as the children get supported, their morale boosts up, their self-confidence increases.
Yes. So in this manner, we understand that every child needs to be encouraged and every child needs to be accepted the way he or she is. And these early intervention or these early identifications help to give a child the best possible start in his or her life.
Yes.
Okay.
And additionally, actually, I want to quote here that even if the child is suffering from some kind of a specific disabilities, then we have to recognize that. As parents, actually, we have to accept this. And we have to seek supports from others, from a specialist. And once the child is certified with the special needs, they can get legal benefits.
Yes.
Benefits like exemptions in exams, some specific instruments, allowance of using these instruments, for example, calculator in exams in case of with learning disabilities.
Yes.
Yeah. So this is very important.
Yes. If the parents are supportive enough or if the parent is having the approach that my child should be included in everything, then we should be looking for this early identification and the rectification of the problem as early as possible. Okay. Now, Mr. Dipak, I would like to know some of the real life experiences where these early identification has helped a child in a positive manner.
Oh, I am very curious to share some of my experiences. Actually, I want to quote two of examples, which is very critical to understand why early identification is important.
Yes.
You know, in one example, I am talking about a child, 13 years old.
Okay.
He had mature cataracts in both of his eyes. You see in this picture, actually, the lenses is very opaque.
Yes.
So he was not able to see anything because of this mature cataract.
Yes.
And you know, there is very simple surgery. The child was in need of replacement of those lenses.
Yeah.
But what happened? The parents, they were not agree.
Okay.
They were not confident enough. We tried a lot, but they didn't accept.
Okay.
What happened then? The child started losing his vision because that cataract changed. Those cataracts changed into glaucoma.
Oh.
And once after having glaucoma, the child started losing his vision.
Oh.
And it was very painful for him also. So the parents ran after us. And then there was a complicated surgery. Okay, after surgery, he lost more than 50% of vision. And that vision couldn't be regained.
Oh, that's a painful example.
Yeah.
So, Mr. Deepak, now I would like to know some of the examples where these early identification has helped a child in a positive manner.
Yes, I have one example of a girl child. Actually, she belonged to a very remote village.
Yes.
So I was a part of Sight Savers International, and then I found that girl in a village, and we approached the child's parent, and the parents were agree.
Yes.
They were much happier
Okay.
to support, to know that okay, their child can get education. And the child was enrolled in the school of the village. Okay.
Yes.
And we counseled the teachers also. It was inclusive education setup.
Okay.
And then she started studying there. I taught her braille skills and mobility, orientation and mobility, so that she could move independently. After some years, she studied in NAV Delhi, National Association for the Blind Delhi.
Okay.
And you know now, she is pursuing her master degree from Jawaharlal Nehru University.
That's a brilliant example.
Yes. And the most important thing is that after completing her education, she wants to be a language teacher and serve her village.
Oh, wow. That's really very good. And it is, of course, an example where this early identification has helped the child, and now child is independent, sort of independent. Okay, that's really very good. Thank you so much for watching the video.